Visit Elmhurst.org to explore the new City of Elmhurst website. Find out the latest Elmhurst news, pay utility bills and parking tickets, report concerns, and much more. Elmhurst.org is an ideal way to discover what Elmhurst offers your business, your family, your life.
Good morning and welcome to Community Conversations. My name is Kathy Jordan and I am the chairperson for the Elmhurst Senior Commission. The Commission provides information, advice, and advocacy to enhance the quality of life for the adults in Elmhurst. Today we have a wonderful presentation to provide to you, and our commission actually likes to empower you with information before you get into a crisis, so that you can utilize that information and use it to the best of your ability to make good decisions in case something happens within your family or with friends that you know. Before we start, I would like to thank Lexington Square for providing the treats. I'd also like to thank Mayor Morley and Jim Grabowski, the city manager, for all of their support, and the aldermen, because without them we wouldn't be here. I'd also like to recognize our commission members that are here today: Jackie Haddad, Chris Hansen, Grayson Haller, Monica, and I'm always saying her name incorrectly, but I'm going to say it the Italian way, Barticello, and Ruth Maple. They're here today, and without their help, we would not be able to have some of these presentations and some of the wonderful things that they provide for you as community members. I'd also like to recognize Helen Fitzpatrick. She's from Metropolitan Family Services, and I always like to share that their office is located right here in City Hall. They are chock full of lots of information that you might need as a senior, and I encourage you to use that because that is actually subsidized by the City of Elmhurst for you. Without further ado, I'd like to introduce Carol Rasko, but before I do, she's our presenter today. I asked her for her bio. I always ask people for their bios, and hers is a little interesting because it's exactly what we try to share, that you need to empower yourself with information. So I'm going to take a little bit of time to share with you her bio with you because it's not the typical bio. And I think once you hear it, you're going to say, well, gee, that resonates with me. It's something that I need to do for myself as well. So I'll tell you a little bit about Carol. During Carol's career as an account manager with a Fortune 500 company, her focus was to act as the liaison between the customer and the company as a team leader. Carol learned that the relationship with the customer is primary in the process of reaching the best solution. In addition to her career as an account manager, Carol has owned 2 businesses. Staff relationships and business direction, schedule coordination, consulting, and detailed research were some of her responsibilities. The goal of Carol and her team was to teach the best solution in all aspects of business. As Carol approached retirement, her husband was diagnosed with MCI, mild cognitive impairment. She had extensive research and asked numerous questions. The current sources of information through the internet were not available. In the beginning, the cognitive issues were minimal, and life seemed to progress as usual. As behavioral changes progressed, the diagnosis progressed to Alzheimer's. During this time, health issues advanced with Carol's mother. Her mother's dementia progressed, and she required full-time skilled care. Both passed away in the same year. Knowledge became power, and the daily normal lessons learned by experience. Carol's new career was a 9-year education on dementia, including services and resources for families, caregivers, and patients. Carol has been a participant and a co-facilitator for support groups. Currently, she is the facilitator of a support group for anyone caring for anyone who has dementia issues. Through education, relationships, professional and personal, and experience, Carol has become a specialist in many issues. Compassion and understanding guide her in helping others to reach their best solutions. ElderWorks is an opportunity to reach out and continue assisting others in finding their best solution. It is an opportunity to give back for the help she and her family has received. Now, I share this with you because this is exactly what we are about, making sure that you make good decisions when a crisis hits. So without further ado, I would like to introduce Carol Rasko, our presenter today, and she will be sharing solutions to many issues. Carol.
Thank you very much. Thank you, Kathy. I'd very much like to thank the Commission for inviting me today. I'm looking forward to meeting with all of you and talking with you and giving this presentation. Thank you to Grayson for assisting me over here. I do appreciate it with the program. So the title today is Advocating for the Elderly, Finding the Essential Resources That'll Make Life Better. But truly, I'm looking out, and I don't think this is just for the elderly, it's for all of us. And of course, we don't think of ourselves as elderly. We're all aging, but we want to age correctly. We want to age and do things that we like and have our life go as we'd like. So our agenda is to plan, getting ready and planning. What we're going to talk about is planning. We're going to talk about the levels of care available when those are needed. We're going to discuss financial options and how we pay for all of these care options that we need and all the things we find that come along, and aging gracefully. I think you've already started to plan because you're here with us today, and that's an important step, and thank you for coming. Caregiving is mainly provided by family members. About 2 million employed persons do informal caregiving. And you're probably thinking, what is informal caregiving? Well, I was doing that initially for my husband, as we talked about. He was doing well. He was still driving, able to get around, but I was keeping an eye on everything that was sort of going on. Or maybe you have someone that needs some help setting up medications, and that might be it. They can do everything else on their own. Or a little bit of a memory issue. That's sort of informal caregiving. But there's an additional 6 million people employed that have disabled spouses or family members or parents and need assistance with what we refer to in the healthcare industry as ADLs, activities of daily living. That really can be dressing, it can be anything, making meals, doing medications, setting up medications. It's all the activities that we do, someone to assist with showering, that type of thing. Informal caregivers, the ones that just do sort of minimal, represent about 9% of the workforce. This is expected to grow as the population, of course, increases. The number of Americans at age 55 for changing demographics is expected to increase from 34 million, which was the number in 1995, to 65 million. By 2025. That seems a ways off, but think about how we're going now. You're hearing so much about baby boomers and what's going to be in up and coming. That's really what they're talking about. 12 million elders will require care by 2020. We're all going to be in 2015 soon, so that's only 5 years from now, which isn't that far down the line. I'm looking out at the audience today, and talks here about women being the primary caregivers, and it said that they are really the recipients and providers of most of the long-term care. 73% of the caregiving is for chronically ill elders is done by women. However, now we're seeing that 44% is done by men. And as I'm looking out today, I see we have quite a few women who have come today, so maybe already you're doing some type of caregiving and looking for some answers today. When you start planning, you have to really think about a lot of things, and these are things that you've probably thought about already. what kind of illnesses affect your family, because if you know that, obviously it can begin to affect you or other closer members to your family. How old were your parents and your grandparents when they passed away? Most importantly, do you have powers of attorney in place? Do you have it for health care? Do you have it for finance? Have you looked at a trust, living wills? Now, we work with a lot of elder care attorneys, elder law attorneys, and elder law attorneys really are excellent resources for you that can help you with any type of legal information and planning that you need. Many people, when we're married, and this was the case with my husband and I, will have a power of attorney, and it will be for each other. So if something happened to me, he would make the decisions on health care, finance, and anything else that was necessary. And I, in turn, would do the same for him. And then my husband became ill and really was not cognitively in a place that he could make the correct decisions for myself or for him. So I found out very quickly I needed to do some reevaluating of our documentation. And you have to bring in then other people that can make those decisions. Now, most of us have children, adult children, so often they're the second or third option of people to make your decisions. But that's something to think about. The other thing is, have you had this conversation with your family? Because many of us do not. Oh, yes, we've talked about it. Well, we had talked about it too, but all of a sudden it became the conversation that was needed ongoing because things were changing very quickly. It's very important to let your family know what you would like if something happens to you, or if things progress to where you need to make other decisions, to inform them, to bring everybody in if that's possible. Where do you see yourself in the future? What kind of a lifestyle do you want? Obviously, we're all enjoying our lifestyle that we have now. We got up this morning, we had the choice to come here, we have the opportunity to listen to a presentation, get some more information for future for us and for current. You want to think about that. You're going to be looking at, can I live in my home for a long period of time? So those are all things to be considered and to really talk to your family about. Do you need life insurance? Do you have life insurance? And do you have long-term care insurance? Now, if you're getting into a situation where some care is needed for yourself, a family member, or a loved one, one of the ways of having some additional help is called adult daycare, and you're probably all familiar with that. In an adult day situation, it's really an off-site. In other words, you're taking or getting transportation for the person to another location, and they can be dropped off during specific hours. Often adult day starts early in the morning because a lot of people work, and is there and available until about 4 o'clock. But there are many situations where you can choose the hours you wish to come in. So maybe arriving at 10 is convenient for you and picking your loved one up right after lunch. So you can choose that. It gives a little respite for the caregiver. What happens is that we all feel as people need some assistance, oh, it's fine, they can stay home for a bit of time by themselves. But sometimes things begin to happen and it really is not safe for them to be at home. So it's always good to look into adult day situations. It's a structured environment. They do offer meals usually, activities, socialization, which is important for all of us. And some of them even will do showers. So it really is a large continuum of what the availability is depending on what plan and what place you go to. We can always help you with that at ElderWorks. That's what we're here for. There is also home care. Now there's two types of home care. Medical home care is where you bring in an agency to assist with other needs. All home care companies in the state of Illinois must be licensed. It's very important. Often when we start needing help, we're very good about going out, and I have to admit I did the same thing, and finding a friend or a neighbor or someone we know that says, oh, I'll be glad to come in and help you with this person. I'll be glad to take care of them for a few hours every day. That sometimes works in the initial stages, but when someone needs care and you're leaving that responsibility, you really should be dealing with a home care agency that is licensed, an agency that is bonded and insured. Also, when weather gets bad, of course, we know that here in Illinois and Chicago is happening, coming up quickly. Sometimes they can't make it. If you're with an agency, they find an alternate person. If the caregiver has a family emergency, the agency finds an alternate person. And you also have then responsibility, and you have someone backing what's happening at your home. Home health care can provide skilled care as well. Skilled care is what we all think of as nursing home care. So if you have someone that is bedridden or really needs extensive care, a home health agency can come in and do that for you also. They can also administer medication for you. They can help them with bathing, and they can do nursing supervision. Many of them have nurses that oversee all of the cases and a nurse that would oversee what's going on at your home. I would suggest with home care, we always give some options, 2 or 3 options. You talk to them on the phone, then kind of test your instincts, trust what you feel, and if you have a warm and fuzzy, then go further and have an ongoing interview with them, have them come into your home, do an assessment, see what's happening there, and that helps you make a really informed decision. You also can get a home care companion, home services we call that, which is non-medical care. And that's really companion care, assistance with daily living activities if you need it, again, meals, overseeing what's going on there, companion for appointments. You can get a driver, so if the person wants to go and get their hair cut or you have a shopping list, that type of thing, you can have them go with the caregiver. Gives a little bit of a break for you as the ongoing caregiver or the person that's there all the time. And in addition to that, we'll let you also have the person you're caring for have some additional help. If you're looking at, can I really stay in my house any longer, or my house is getting too big, I would sort of like to downsize, then we go to the option of a retirement community, which is an active lifestyle, houses or condominiums. Del Webb was one of the very first that developed these types of communities. I think they started in Arizona. We have several here in Illinois now. We have additional communities here also that are retirement communities, active lifestyle. Let me tell you from experience that these are truly independent. You're living in a wonderful senior community. They have activities, they have wellness centers, they have maintenance-free living, but many of them do not have transportation internally. They do not have some of the additional things that you get if you go into other type of housing. So you're really moving from one home larger that you have now to another home that's often a smaller size, but you're going to have to really oversee many of the same things that you're seeing now. The advantage is that you have a nice senior community there that can join you with activities, and most of them have fitness centers, pools, all that type of thing. When it gets to a point that you decide you really don't want to have a house anymore, and you really feel that you're in a position where you need to go into a independent living community, there are several. An independent living is in a community, a building, as we would think of it very often, which has everything you need, but also offers then meal packages if you're interested in that. You have apartment complexes. Sometimes they have small townhomes affiliated. Laundry's not included, but they do housekeeping in most cases. What you can do to decide what's going to be most convenient for you is to make a list. It's important when you're planning to decide, what am I going to need? What am I looking for on my side? So make a list before you start visiting all of these communities. If you call ElderWorks, we can give you a list of the communities in your area. We really work with you and find out what is most important to you. Our service to you is at no charge, and it is person-centered, family-centered. So it's all about you and what is most important to you and what you're looking for, and then we can direct you appropriately. Excuse me. In an independent community, when you make a visit there, and that's what you want to do, of course, check out the residents. Look around, see, are they friendly? Are you enjoying being there? What kind of a feeling do you get in this particular place? What activities are going on? How do you feel about the way the day is structured and what's happening there? And then go back and visit when you're not touring. Just drop in, which you can do anytime. Good thing to remember about any of these living communities that we're going to be talking about, starting with independent living, is that they're open 24 hours a day, 7 days a week. So you don't have to go between 9 and 5, and you don't have to show up during the week. You can go on a weekend, you can go in the evening, and that's always a good way once you're starting to narrow down your choices, because then you see how things are kind of on an off time, so to speak. Other choices would be a continuing care retirement community. This is usually referred to as a CCRC. It's a large campus. So there's usually several buildings or several apartments there. Sometimes they have townhomes affiliated. It encompasses all levels of care. They often, you can go in as independent, which is most often required, or with minimal assistance. And then as you needed more help, you can move into other levels of care, or they have it available. They most often have an entrance fee. So these are communities that you've probably heard people say, oh, I had to buy in to that community. That's what we mean by an entrance fee. On a CCRC, continuing care, it's all levels of care for the rest of your life, even if your assets are depleted. So the way it generally works is you put in X amount of dollars as a buy-in. If something happens to you, 90% of that, in most cases, goes back to your estate. But in the meantime, you have that little bank of money there. And then you also will have a monthly fee as well. Most people feel if they go into a CCRC, continuing care, that they will not have a monthly fee because they have bought into the community. This is not the case. You will also have a monthly rental fee. Now, in some communities, you can choose to put down the amount that's required and to have a lesser percentage go back into your estate when something happens, and then that would bring your monthly fee down. If you are an independent and now you need assisted, as you move to assisted, they have it available or can bring assistance into your apartment, but that monthly fee may increase somewhat. Some will only allow you to come in if you're independent. They won't allow you to come in later. They do not typically accept Medicaid. That's the other side of that. So what will happen is if you deplete your resources and you're not able to pay any longer from a private pay standpoint on your monthly fee, then they go into that reserve that you have given. And once that is gone, they will still take care of you the same as always for the remainder of your life. So that's the reason really for putting in that entrance fee. Next, you could go to assisted living. Currently, we have 342 licensed assisted living communities here in Illinois. In 1995, they began legislation, and finally in 2001, it took effect, stating that there would be, by the Assisted Living Federation of America, that there would be a special combination of housing, supportive services, assistance, and health care designed for the individual who needs it, and the activities of daily living. Supportive services are available 24 hours a day. Assisted living can be independent with minimal medical problems and some issues that need independency. So for an example, you may be in independent living, but perhaps you need some help with medication. And if that's the case, the assistance would come from that side. They have activities and programs in assisted living, full or partial kitchens, on-site nursing up to 24 hours a day, so all the time. It's another little tip if you're looking at assisted living. Most of them will say we have 24-hour nursing care. The question is, do they have a nurse on site that lives there 24 hours a day? Do they always have someone on site? Or if mom falls or has a problem at 2 in the morning, do they have to call the nurse and now she comes in? And she's really only there during the day hours. So that's always something to ask. They have a central, a central dining area for all meals. Again, Medicaid is not accepted. Many of the service at a typical assisted living facility are 3 meals a day served in a common area. If you're at a level of assistance where you need eating assistance, bathing, dressing, going to the bathroom, walking, they offer that as well. Housekeeping services. Obviously, they have transportation. They do outings and so forth. Access to health and medical services, and they have round-the-clock security. They also have emergency call systems in every resident's living space. Exercise and wellness programs. Obviously, socialization and exercise are very important. Medication management, again. Laundry services. Social and recreational activities. And the staff is available to help you really with whatever needs arise. When you go into assisted living, or if you're taking a loved one to assisted living, there are some tips to make that easier. It's definitely an adjustment, but I would say that I think it's an adjustment even if you're going into independent living, because when you're moving from the life you have now and the schedule you have now and the way your routine is now, and you're moving into a community that's providing a lot for you, but on the other hand, it's a change and you're eating some of your meals there and so forth, obviously it's an adjustment. So it always feels stressful at the beginning. I think everyone goes through that. And there are things that you can make it easier for yourself. One of the things is before you make any of these moves, even for assisted, pack well in advance of the move. So don't leave decisions to the last minute and don't stress over what you're going to take and not take. We have a sister company, Paxum, and we do help you with packing, moving, reorganizing, decluttering, and we can come in and assist you with that under your direction. But it's very overwhelming to be moving and then to have to make all of these decisions with things that you've so often and so long had in your possession. I can speak from experience on that. My husband and I moved to a new house that we built in a Del Webb community, actually, about 12 years ago. And we came from a bigger house and went there, and totally independent living, which was fine. And all of a sudden, I had all this stuff that I didn't know what to do with and couldn't part with, I might add. So I had to start deciding what can I take and not take. And so that paring down really was difficult. Now, I happen to have family and friends who were very helpful and came over and packed because, as they tell me now, I couldn't make any decisions. So we would have a pile for keep, a pile for taking, and a pile for giveaway. And I was sort of on a thumbtack in the middle going around, is what I've been told. So it happens to all of us. But you do have to pare down what you've got. My mother was great about this. When we used to go to visit my mother, and she would have a dinner, or we would be there just as a visit, and she'd have something, and I'd say, I've always loved that. And she'd say, oh, that's nice. And the next thing I knew, it was boxed up, and I was taking it home. She said, it's yours now. So sometimes that's a good way to start moving forward. I think we're finding our children, in many cases, really don't bring all the things with them that we have had in the years past, or they don't want to polish silver, and they're not as interested in grandma's heirlooms as we've been. So sometimes giving them to some friends who appreciate that. I have some special things that friends have given me, older friends that I had, who have since passed away, and they're very special to me, and no one else in their family wanted them. So start looking for people now, and some of those things you can start unloading ahead of time, which is always great. Also, know what to expect. Do your homework on the facility. We can help you with this at ElderWorks initially, giving you all types of information, and the communities and the places that you have for choices to live are wonderful about assisting you with this as well. They are very familiar with making these kinds of transitions, with people coming from a home or from another environment and into what your decision is for this time. We also often have couples where one needs assistance and the other one is still really in independent living. So you're dealing with that person who is needing more assistance or having maybe some memory issues, and you're trying to get moved at the same time, and it's very stressful. And so they understand that the communities will work with you as well. Stay busy. Well, you can hardly not when you're going to be making a move of this type, but it is important. Once you get into the community, stay busy, because we all seem to like to stay in our apartment or our new house or our little environment that we've now moved into, unpacking or trying to busy ourselves. But it's important to get out into that new community and start to become part of it. You don't have to join everything, but try to be sure that you always go to the dinner meal or the luncheon meal, move around and meet some new people, try an exercise class. If there's an activity, go and attend it. After a period of time, you kind of figure out what your routine and daily adjustment's going to be. But before that, of course, it's a change and things are different. But you've never had the advantage of walking out your door and everything's available to you right there. So that's kind of nice. And when it's bad weather out in Chicago in the winter, you don't have to go outside, but you have all kinds of things to do right there. So there's great advantages to that. And also, go easy on yourself. Don't feel that you should make this adjustment quickly, that, you know, oh, gee, I should be more adjusted now. Give yourself a break and give yourself some time, and you'll find it'll work well. Another type of living facility is called a supportive living facility. This is an alternative, really, to a nursing home environment. And they do care for low-income older persons or persons with disability under Medicaid. So in supportive living, I'm sorry, I should backtrack here. The Department of Health Care and Family Services obtained a waiver to allow payment for services that are not routinely covered by Medicaid. So what happens in a supportive living facility is there's personal care assistance, there's homemaking issues that are taken care of. They do provide meals and activities. They do laundry. There's medication supervision. There's social and recreational activities. And there's a 24-hour staff on site for residents. Let me mention a little something about supportive living. We're getting more and more calls from social workers, case managers, and families where we have an older adult who really does not have much income, and maybe their income is only their Social Security and they have no other assets. If they do not have memory issues, there are some with memory areas in supportive living, but only a couple in Illinois. But if they do not have memory issues, supportive living is a very nice option for that, because the person can go into supportive living. It's covered by Medicaid. They have all of their meals. They also bring in medical, so they bring in doctors, dentists, all of the above, and they have wonderful activities and things going on, and it's a very nice environment for them. So it's a little bit higher level of people in exchange of information and socialization than a nursing home environment. It really is like an independent assisted living for older adults, but these are adults who usually have low income. Memory care. I could talk about this for 2 hours. Memory care facilities are always built with safety in mind. They're a secure property. Different levels of memory care. You may have someone in memory care who does not wander or does not have that type of issue right now, is not trying to flee the area, so to speak. So they could go into memory care, which is secured as far as the main doors, but move around inside. For those who have wandering issues, there's also memory care, usually in the same facility, that is a secured environment, meaning that they are in a certain area where they have meals and they have activities and they have apartments and everything going on, but they cannot leave that secured environment into the main building itself. So it's a much more secure. Memory care facilities are very sensitive to memory care needs. They're for Alzheimer's and dementia patients. Remembering that dementia is really the umbrella. Alzheimer's is only one type under that umbrella. There are several others. Some of those bring behavioral issues, maybe difficult behavioral issues. There are some memory care facilities only that focus on just memory care and don't have other levels of care, and they can deal with behavioral issues. So we can always help you finding the appropriate place if you're dealing with someone who has memory care. Medicaid is not accepted for memory care. They do have reminiscence programs. They do have structure, which is extremely important when you have anyone with any type of memory issue, even in the early stages. And they do have events and activities that are at their level. And many of them also have animals. Now we're seeing that also in assisted living and independent living, but again, that's why you want to visit these communities, because if you have someone that's going to be going into a community or yourself and you're not into animals, and it's a community that has a lot of animals around, as many do, because it's been shown that they really improve, that it's very healthy and very helpful, then you would want to look at another option if that was not what you cared for. We also have sheltered care. Shelter care really provides maintenance, personal care, and socialization. Most of the people who are in sheltered care are either independent or in a assisted, but need a higher level of assisted care, but they do not need nursing home care. It's a little different from assisted living. One, you don't need an assessment prior to going into sheltered care. You do for assisted living. CNAs are providing the personal care, so they're providing the bathing, toileting, all of those things. There are stricter reporting requirements for the state of Illinois for accidents, abuse, and injuries when you're in sheltered care. You have to provide 21 days of if you're going to involuntarily leave. It's 30 days when you're in assisted living. Many people will choose sheltered care because it gives a continuum of care in the same facility. The other thing is that most places that offer sheltered care also offered skilled nursing care, nursing home care. So if someone falls and breaks their hip or their leg, or they need nursing care for a period of time, they're in shelter, they can usually move into skilled at the same facility. Skilled nursing facilities. This is what we have all called nursing homes in the past. And when all of our parents, and probably many of us, would say, I'm never going to a nursing home, they really have changed. And they are really built for those who require a high level of medical care. Dependent on the skills provided by the nursing home staff. So you have to find the correct nursing home for the person that you're looking for the placement for, because not all of them can do everything. So if you have feeding tubes involved with the person that would need to go to nursing home care, or they have certain wound situations, there are some that can handle that, not every one. So we can help you with that, and we can really direct you to the ones that would be correct. Also, they have meals served in a central dining room. They can also be served at bedside. They do try to encourage the residents and bring them down for meals, of course. Activities are scheduled. It's regulated by the state. Skilled services may not be covered by Medicare for a short stay, but Medicaid may be covered there for a long-term custodial stay. So if you had someone that, for example, let's say they had a broken hip, and then they went into rehab and they could not come home, and then they went into skilled care, to a nursing home care facility, that may or may not still be covered by Medicaid, depending on, or Medicare, depending on what the timing was. But if the person was on Medicaid and now could not go back to wherever they were before and needed long-term care covered by Medicaid, many of the skilled nursing facilities do have that. One thing I want to mention to you about skilled nursing, if you have someone with memory issues and they're on Medicaid, there are locations that accept Medicaid, but they will not they cannot accept it in the memory care area. So sometimes if you have someone with a memory issue who needs to be placed and they're on Medicaid, they cannot pay, they will need to go into nursing home care. Those are things we can talk to you about. We know those facilities, and we can direct you to the appropriate facility. How does assisted living differ from nursing home? Well, nursing homes are really designed for care of someone who's more frail. They're not able to care for themselves, and they have numerous care requirements. Assisted living is necessary when a person just needs help. They may need help with just a couple things, or they may need some assistance with everything. So the nursing home, the assisted living can handle that. There are also friendship or companion suites, and this is where seniors are brought together to share an apartment at a cost savings, and of course then they will form new friendships. Other options are community service that provide home sharing opportunities. And Center of Concern can lead you to those in Park Ridge, and there is a website for them there, or we can help you with that. So how are we going to pay for all of this? What are the sources of funds of housing cost over the long term? Private health insurance is strictly for medical care. Every week I have families that call me and say, Mom really needs to get into assisted living. She's got great insurance. I'm sure it's going to pay for it. Regular insurance. No, unfortunately, it won't. Long-term care insurance, in some cases, will. There are a lot of specifics on long-term care. Some of them will pay for you to go into a community, into assisted living, into more skilled care if you need it. They also will sometimes pay for you to have in-home assistance. So those are things that need to be looked into. For the most part, the cost of living for seniors is going to be covered by your own personal or family money, pensions, Social Security benefits. So essentially, it's private pay. Now, there are locations that you can get into with Medicaid if you are not able to pay privately. But that's becoming more and more difficult. So again, we're back to planning. If you have limited assets and you're concerned about what the future brings, you should call us. We can help you, and we really can direct you to the best places for this. Also, there is Supplemental Security Income, SSI. That's public assistance for seniors or disabled who have limited income and assets. Now, there's just been a facility which opened a couple of years ago up in the Huntley area called Deer Path, and many of those people are on SSI. They're veterans who were disabled, and they really don't have any other place to go, so they're living there, and it's a supportive living environment. So they have all types of activities going on. They're getting meals, someone's overseeing things, but they also are living independently. Sometimes if you are not able to pay for new types of living, independent or assisted, but you know you need to make a change or you need in-home care, that's when a reverse mortgage would be beneficial, or a home equity loan. Many families have to go to that extent to afford some of this care. We can always direct you to people who work on reverse mortgages. We can also direct you to realtors, any type of assistance you need, and these are people that we work with all the time. Our realtors are senior certified, and we know them. We know all of the people that we work with, so you can be assured that you're getting the highest level of care, and what they're doing for you is what they should be doing. Long-term care insurance we talked about. Medicaid is people who have very limited assets and income, has to be applied for. It takes some time to get approval. So do keep that in mind, and we can help you and direct you in that to some elder law attorneys for that. Senior resources, we have ARP, the Alzheimer's Association, National Academy of Elder Law, and National Association of Professional Geriatric Care Managers, Family Caregiver Associations, like you have your commission here, who's wonderful. And in addition to that, at ElderWorks, we published this directory, which was outside. It will be there when you leave. Please take as many as you would like. If you have adult children, get some for them as well. These are all the services that we know of in the state of Illinois for seniors. I have my contact information on the front. This is just an overview. When you call us, we find out specifically what you need, and we can help you from there. We're always available. Remember, we also have PACSM, our moving, reorganizing, and decluttering. So I hope it's been advantageous. And Kathy, thank you very much. Thank you for your time.
As you can see, Carol is a wealth of information, and this book, I encourage you to take this home and actually take a few extras for your friends or anyone that you think would need them, because it is really chock full of useful information. Carol, thank you so much. Your presentation was wonderful. I'd like to share with everyone that the Commission this spring is actually going to have a transportation and housing fair on April 22nd. You'll be getting information about that shortly, but that was something that came to surface at a group meeting, that was something that the community really wanted information on. And that information will be actually for Elmhurst housing. So it's not outside of Elmhurst. It will be what is available on housing in Elmhurst. So it's kind of a local fair, and we hope that you attend. I always like to close with a nice little saying, or a moral inspiration. The best thing about the future is that it only comes one day at a time. So with that thought, enjoy the holidays. Thank you so much for coming to Community Conversations, and we look forward to seeing you in the springtime. Thank you so much.
Hi, I'm John Quigley, President and CEO of the Elmhurst Chamber of Commerce and Industry. In these challenging economic times, it's imperative that our residents and businesses band together to not only shop Elmhurst, but buy Elmhurst whenever possible. We have great stores in our city center, Spring Road, Butterfield Road, York and Villette Streets, St. Charles and Route 83, North Avenue and Lake Street, along North York and even Grand Avenue. I ask for your help. Let's keep our tax dollars in Elmhurst.